Hi, welcome. Thank you for joining us this evening. You are in for a treat. I know how busy everyone is, and I'm welcome you to our last CAPES webinar on Does Changing Health Behaviors Help Your Arthritis? Lifestyle, Myths, and Solutions. This is your chance to really sit back, relax. You're going to hear from patients and physicians about a very interesting topic, so please remember to put any questions you have in the chat for us. We'd be happy to answer it in our live Q&A. This will be an educational series on wellness, or educational webinar, I should say, on wellness through an education grant through Pfizer, with a joint participation between SPARTAN, GRAPPA, the SAA, as well as the National Psoriasis Foundation. Next slide. So just to orient you, our agenda will include a patient perspective. So you will be hearing about Brian's story and Brandon's story, and then we're gonna go into a nice lecture on the immunologic basis of wellness for spondyloarthritis patients and why we want it with Dr. Elaine Calabrese from the Cleveland Clinic. And then we're going to end with a panel discussion where we are going to answer questions just from you, the audience. We're so glad that you're here joining us. Next slide. So as we begin, we wanted to start with the patient perspective. So we wanted to better understand how lifestyle modifications may have affected patients that, just like you, have either spondyloarthritis or psoriatic arthritis. So I really want to bring a warm welcome to Brian LaFoy and Brandon Robert. And I'm going to have each of them share their perspective with you. So next slide, or we will have Brandon start. Or Brian, sorry.
I think I'm supposed to start, Dr. Husni, so I'll go ahead and begin.
Awesome. Thank you, Brian.
Hello, everyone. My name's Brian LaFoy, and I have psoriasis and psoriatic arthritis. I've lived with these diseases for most of my adult life. I'm 52 now and was diagnosed with psoriasis in my early 20s and psoriatic arthritis in my 30s. And my journey with psoriatic arthritis started over 15 years ago. And something that has always been very important to me and has played a huge role in my mental and physical well-being is my lifestyle. And I've played competitive sports and pursued extreme sports my entire life and still do today. And right now I play ice hockey several times a week. I play indoor soccer. I surf several times a year. I snowboard, and I coach most of my kids' sports. So I stay very, very active. But one day about 15 years ago, my right hand and fingers started to hurt almost overnight. And not just hurt, but the slightest touch would nearly drop me to the floor in pain. And I played a lot of indoor soccer at the time and ice hockey, so being hurt was not anything unusual to me. So I didn't think a lot of it. Having aches and pains all over was just normal. But this particular pain intensified over the period of just a few days to the point where it was debilitating, and I couldn't perform basic daily functions like opening the refrigerator, driving, typing for work, and I certainly couldn't play sports. So I was puzzled, but I still didn't think much of it. I went to the doctor thinking something was just broken or sprained, but all my x-rays and exams came back negative. And since the doctors couldn't diagnose what was wrong, they decided to perform exploratory surgery on me. And they opened up my hand along my index finger all the way into my palm. And even after that surgery, I still had no diagnosis. I still had the pain. And so the doctors put me on some terrible antibiotics with some just awful side effects, thinking that I had some kind of bacteria inside my hand. I couldn't handle the side effects, so I stopped taking them, and I said, this is ridiculous. I can't do this anymore. And I felt like I was pretty much out of options, but I was not going to give up. So I needed to figure out what was happening because it was still impacting my ability to work and play sports. And honestly, what probably drove me the most was not being able to play sports. So just through a lot of my own research, I finally diagnosed myself. And so I took my diagnosis to my dermatologist at the time, who was already treating my psoriasis. And he confirmed immediately that I was right and I had psoriatic arthritis. And so I felt really stupid at the time because I'd been around this disease my entire life. My dad has it, but it just never occurred to me that that's what this was. And so initially medicine was the answer, and being on a biologic medication helped me return at least to the quality of life I wanted. But I still lived in pain every day. It was just more tolerable. And I've since had many other joints impacted. So I began to explore other lifestyle changes to supplement the benefits of what that medication has done. So because psoriatic disease impacts everybody differently, and even responses to treatment, whether through medication or natural relief measures, can vary, it's definitely a trial and error process to find out what works. And so some of the methods I've explored that I'm sure we'll discuss later in this discussion, number one is maintaining my activity level, because that's such a huge part of my happiness and well-being, as I mentioned, and just keeping my body active and healthy. Number two is I've changed my diet, not necessarily going on diets or dieting, quote unquote, but changing what I put in my body and making healthier choices. Getting more sleep is another one. I went a lot of years on not very much sleep. And what I found over the years is I can make it through the day fine, but psoriatic arthritis just wears you down. It just does. And so I try to ignore it during the day or when I'm doing things that are fun or active, spending time with my family or playing sports, but it hits me pretty hard at night. And so what that means to me is it's more important for me to try to get enough sleep at night to let my body heal and take on the next day. And finally, just keeping my stress levels down. I think that's been a big trigger for me. And mostly that comes from being able to maintain my activity level. And now that I have kids, that's a big help as well, because I love spending time with them and doing things with them. So I'm fortunate to have a really good support group with my family and friends. And I've had a great doctor who's helped me manage this disease. And I also believe that God's blessed me with this condition now to put me in a position to help others. So I've become a patient advocate, not only to help others with my story, but also to hopefully make a difference in finding a cure during my lifetime by partnering with doctors and researchers and other patients. And my hope is ultimately to someday have a cure, but in the meantime, I just try to find lifestyle solutions that allow me to continue the quality of life that I want. And I hope to do that someday naturally without having to have any medication. I'm also a third generation psoriasis patient, so I feel it's my job as a father now to do everything I can for my children and equip them with the tools and practices I've learned in the event that they someday have to face this. So thank you for your time today and being with us and listening to our stories, and I look forward to our discussion.
Thank you, Brian. That was a really nice summary synopsis, and I think resonates probably with many people on this call. And now I'd love to hear from Brandon and hear his story and his perspective as well.
Hey, Dr. Husni, thank you. And thank you everyone for having me on. I'm looking forward to the Q&A after this and kind of sharing my journey through ankylosing spondylitis. I was diagnosed with it probably 6 years ago now, but suffered from problems with it since probably my early 20s, although I didn't know what it was. And I'm a lot like Brian. I've always done a lot of sports where injuries are pretty common. A lot of snowboarding, a lot of wakeboarding, skateboarding. And so anytime I would get hurt, or like my back would hurt, I would just kind of, it was always associated with like something I was doing with the sports. And so I just kind of, I just think everyone feels like this. And then, my first time where I experienced what it feels like to not be able to walk, I think I was like 19 years old, maybe 20 years old. And so I just kind of, I was riding my bike at the time. So I just thought maybe that's what it's from, which is pretty common for people with AS. I think they kind of go through their life without ever being diagnosed until later in life. And so if you fast forward to, 6 years ago, I was training for a triathlon and I got done and I just couldn't walk. And it's very immediate. You just cannot move. So I decided, okay, I'm going to go to the doctor. I'm going to find out what's wrong. And so I went and saw a fantastic doctor. They did a arthritis panel with my blood, and they found the antigen in there that says you can have arthritis. And then with my symptoms, they sent me to a rheumatologist who told me that I have ankylosing spondylitis. So, knowledge is power. I said, okay, now I know what's wrong with me. Now I can learn a little bit about it. And, I left that doctor's office, and one life ended and a new life began. And that is when, I needed to accept some things. And, I always say accept, adapt, and overcome. And that's what I think you have to do to stay ahead of diseases like this. Or else, like Brian said, they'll just beat you down. Just day in and day out, they will just beat you down to nothing. So my life has become just this one giant mission to see how far I can go. So right now I'm training for a 250-mile run in Arizona in May. It's called the Cocodona 250. So that's what I'm working towards right now. And I've done several Ironman events and a lot of ultra running stuff. And it's all just in an effort to see how far I can go. But through these years of trial and error, I've also realized that the further I go, the better I feel. So I want to move. Movement to me is just as important as the medication. And the other things, how you can treat these diseases. I think movement is just as important. And I think Brian touched on this too. For me, I do this for my son because it's a genetic disease. And, if it does come to that one day, then I'll be able to tell him, look at what I have done. You can do this and more. I feel like it's my kind of duty to pave the way for him, do the trial and the error, do the hard work. And then if it comes to that, I can just say, here's what we're going to do. So that's basically my mission right now and what keeps my fire burning. And so with that, I think I'll wrap it up.
Thank you, Brandon. Another nice, inspiring, articulate story of, and thank you so much for sharing openly and candidly about how this disease has affected you and what you've done to help you along the ways. I think this is really helpful for other people to hear. Next, we want to change our gears a little bit and listen to a presentation on some of the immunologic basis for wellness and what we have learned to date and what we know about how lifestyle, habits can really help somebody with a chronic disease. So I'm really excited to welcome Dr. Leonard Calabrese. He's a friend and a colleague at the Cleveland Clinic with me in the Department of Rheumatology. And we talk a lot about these topics, both from just our own perspectives, our patients, and sharing stories of how we can really, get this more in the mainstream to really help people who are dealing with chronic illnesses. So I think you'll really enjoy this presentation. And just once again, to remind you that we do have an open chat box. So if there is any questions that come up along the way, please feel free to just add them in the chat and we will collate them and we'll come back as a panel to help answer all your questions. And no questions are ever too small or too big. We'd love to hear from you. And you have such great people on the panel today that have been dealing with these diseases. It'd be great to have a discussion around this topic with the panelists. Thanks.
Well, I'm really happy to be here to talk about the immunologic basis of wellness for spondyloarthritis patients and to really tell you why we want it. So I'm going to break this down into a number of stanzas. I'm going to talk about why the treatments we have for SPA right now are great, but not enough. What is wellness and why do we want it? And then the power of our behavior, diet, exercise, mindfulness, and I'll throw in a little bit about sleep. Now, finally, I'll talk about something called immune strength because we're excited about it. So this is a shout out to the Spondyloarthritis Association of America. Done a fantastic job supporting patients with SPA, and I think I have mentioned this during this conference that I have non-radiographic axial SPA, and I've had it since I was a young person, and I've been in remission for a long time from it, but it's come and gone over my life, and I understand it intimately. In this monograph, there's a list of the medications ranging from the non-steroidals to the biologics, and these are growing by the day. And only in the past few days have been a new approval of upadacitinib for non-radiographic axial SPA. So a lot of things are coming along right now. So what has this meant to patients with SPA to have all of these therapies available? Well, it's raised the bar. And, we know that these medicines have the capacity to reduce inflammation around the spine and slow or retard radiographic progression and improve quality of life. We're looking for all of those things to do even better things, to improve our ability to work and play and be social. And certainly, one of the major roadblocks are costs of therapy, access to therapy, and beyond. Even when people have achieved a slowing or retarding of disease activity, there are other things that are of concern. Now, this is a slide by Dr. Bingham from Johns Hopkins, and it talks about rheumatoid arthritis, but it would equally apply to SPA. And what we're looking at here is on the left, those are domains in the disease that are prioritized by practitioners, physicians and advanced practitioners. And those are the objective things. What are your labs? What are the x-rays? What is the level of pain on this analog score? And on the right, those are things when we talk to patients who have inflammatory arthritis, such as SPA, that they prioritize. There's more to it than just pain. It's my ability to socially manage and participate. My sleep is lousy. I'm stressed out. I'm fatigued. So while these things are highly related, they are not always the same. These are domains over on the right that patients value that we consider, actually more wellness domains. And of course, there are many that are shared. So what is this wellness thing that we advocate, even in the face of having so many drugs to use to treat this disease? What is wellness and how do we get it? Well, wellness has a lot of different definitions. And I think that, at face value, all of us want them. It's more than signs or symptoms and a diagnosis because all illness is personal. Wellness encompasses a diverse number of dimensions, including mind, body, and spirit. And those things aren't measured by your CRP or your X-ray or your MRI. I think that it includes personal choices, and that's so important because this is a behavior. and we want to achieve that physical vitality, mental alacrity and sharpness, social satisfaction, and personal fulfillment. But, in the end of the day, it's kind of like I know it when I see it. And I tell patients, wellness occurs when lives go well. And I think all of us would agree on that. Empowerment. Empowerment's your capacity to actually get it done, to know I can do it and I can achieve this. And, these are things that we say in our head, I can do more. I want a day without this darn fatigue. Taking care of myself used to be at the bottom of my list. I just would go about my business. But now I'm all about wellness. this is what empowerment is. And this is the first step on the journey to wellness. So let's do a little immunology 101. This is our immune system, and it should be in perfect balance. The immune system is designed to protect us against danger, whether it's an infection or pollution or toxin or an inflammatory disease. So we have defenses that we deploy, and that is inflammation. But it has to be tightly regulated and balanced, or that if you get too much inflammation, that'll harm the host. So everything about immune health is about achieving balance. So this notion of a highly tuned and tightly regulated immune system, let's ask the question, why does it get goofed up? What are the reasons that we don't have this? Well, everyone says, oh, it's in my genes. I have bad genes. I have an uncle with ulcerative colitis, and my grandfather had psoriasis, or somebody in my family has SPA. The genes are the cards that you're dealt with when you're born. But what I'm going to tell you in the next few minutes, it's how you play the cards that determines how those genes work. But still, they're important. Age is another factor. And we can't do anything about our age, but in COVID-19, older people do much worse with COVID than younger people. It has to do with the aging of the immune system. But there's a whole bunch of other things that are modifiable for our immunologic health. What kind of weight do we carry? What level of physical activity do we have? What we eat, how we sleep, how we handle our stress. And all of these things contribute to chronic low-grade inflammation, which are associated with so many diseases ranging from diabetes to cardiometabolic syndromes to heart disease and cerebrovascular disease and beyond. So we can do it. If you have SPA, you have an immunologic condition. Your behaviors modify your immune system. So let's talk about what are the things that I think can be done and things that I know that can be done to help you achieve this wellness. Okay, there are the domains again: diet, exercise, sleep, and mental and spiritual health. Let's tackle them one at a time and talk about, some of the things that we know. Before I go into that and talk about, eating a healthy diet and exercising right and de-stressing, that box I just put up on the bottom are the lifestyle changes that have to happen. It doesn't do any good to go eat a healthy diet and exercise if you're, smoking a pack of cigarettes a day. If you try to eat well, but you have not managed your weight properly, you need to start that long and slow journey to stop gaining a pound every year. And keeping your weight down or getting towards your ideal body weight, or in 20 years, you'll be 20 pounds heavier. Avoiding poisons, which means, overconsumption of alcohol or use of any type of drugs. This is axiomatic. Everybody gets this, and I just bring it to the surface. So wellness, the road to wellness, what does it look like? Well, there's always two roads. On the left, you have, this is easy town. 5 minutes, you're going to be well. Or the journey of 1,000 miles that begins with a single step. And I think that everyone listening to this, because you're engaged enough that you want to learn this, knows that there is no easy town for this. We wouldn't even be talking about it because everyone would do it. So let's start. When you see stuff like this, it's no wonder that, everyone is confused. There are thousands upon thousands of sites on social media and on the internet that, will claim that, drinking water will help you lose all the weight that you want. You don't have to worry about anything. And, if it sounds too good to be true in wellness, It probably is. So let's say that's a caveat for every domain that I'll talk to you about. Very simple. So what is the power of diet in SPA and inflammatory disease and autoimmune disease? Well, it's pretty good. I would say that the dietary studies that have been done in SPA are underrepresented. There's not enough studies in this area. But if we look at other diseases like rheumatoid arthritis, there's tons of studies. And I think that there are lessons to be learned that through eating an anti-inflammatory diet, you can lower inflammation. And, if you're the lingo of SPA, and that, these biomarkers in your blood, your doctor will be measuring CRP on you because that's a very important biomarker. You can lower your CRP with an anti-inflammatory diet. And there's not one diet that'll do it. The diet in the world goes from over here on the right, which is the Western diet, the standard American diet. We call that the SAD diet because it's sad. A lot of refined foods, artificial foods, fried foods, unhealthy fats. And down here on the left are the prudent diets. And that includes things like, being a vegan, which is really tough, but being an almost vegan, a vegetarian. I eat a diet called VB6. I'm a vegetarian before 6 o'clock, and after 6, I'll selectively eat my protein. Sometimes it's meat, sometimes it's fish, sometimes it's another vegetable. Paleo, or mixing paleo and veg, that my friend Dr. Mark Hyman calls the Pegan diet. All of them are acceptable. So how do we go about doing that? Well, I'm just giving you the high points, but this is what we say. I'm a Michael Pollan fan. Eat real food, not stuff that comes in some crazy box that is made out of, all this processed foods. Mostly plants. You can eat protein and meat, but on that plate, a quarter of it's your protein and 3/4 of it is the rainbow. Roxanne Sukol, one of the great teachers of health and wellness, says, eat the rainbow. So Mediterranean, vegan, paleo, pegan, vegetarian, all work for you. All right, so that's step one, diet. I've given you a few tips. Try my VB6. There's so many great resources, and we'll make a monograph available to you at the end that summarizes all of this. What about exercise? Well, exercise and the immune system are tightly interwound, and it can affect how our immune system ages. It can affect us acutely or chronically. It can influence diseases, and it actually interacts with how we eat. So combining exercise and diet is far more powerful than doing either one alone. And then it gets into some sticky science, and we'll move on from that. So if you went down to the, nitty gritty of this, and I gave you, the graduate course on immunology and exercise, I will tell you that regular exercise is associated with immune health, including both our innate immune system, our early warning system, as well as our adaptive immune system, T cells and B cells. And both innate and adaptive immunity is involved in spondyloarthritis pathogenesis. So this has been proven in the laboratory time and time again. But I tell my patients who have autoimmune diseases, there's another huge benefit from regular exercise. And that is that there's a clinical benefit, and that lowers your risk of respiratory infections. And this has been actually found in the COVID era, that people at regular exercises do much better with COVID-19. This is called the J curve. And over here is this is the risk of having a respiratory infection during a cold and flu season. So, this is how our immune system works ordinarily. It works pretty good. Even during a regular season, you're going to get, a few colds. You might get the flu. In the past 2 years, if you haven't had COVID, you're lucky, but those are all respiratory infections. If you engage in moderate exercise, and that is my favorite exercise, which is walking, and I'll give you some guidelines. That lowers your risks of these infections by 40 to 50% during a cold and flu season. And then finally, if you're, an over-exerciser, an ultra-marathon, and run across, Death Valley, you actually will suppress your immune system. So you want to be in the sweet spot of modern exercise. There's a lot of different ways of doing it. In my monograph, we talk about instant recess, and my nurse practitioner Betsy and I, when we get a break during our patient days together, we say, okay, let's do a loop. And at the Cleveland Clinic, which is almost a 200-acre campus, we can go inside, through some corridors and bridges, take a 5-minute walk, 10-minute walk, 22-minute walk. It's stopping this activity, which is sedentary, sitting in this chair all day. So getting up and moving around, 4 or 5 minutes every hour is fantastic. And as it turns out, most people on this planet who live to be 100 years old, none of them are dedicated runners or go to the gym every day. Most of those populations, whether it be in Okinawa or Sardinia or Costa Rica, or the area around Loma Linda in California, they're just active. They're doing things. So aging immune system, it's not good, but we can't do much about it unless we really work at it. And as we get older, there's more inflammation, and we call that inflammaging. And there are data that we can reduce the pace of immunologic aging by maintaining, good levels of physical activity in adulthood. And this is a paper from just a few years ago showing that people that were master cyclists had much better immunologic health, and then markers of immunologic aging were much more robust. And so, keeping active into our older age, by getting out and about and walking and avoid sitting in that couch all day and all night is evidence-based. We're now in a new frontier in immunology, and that's called sleep immunology. And this is a very nice book by Arianna Huffington, who found that her poor sleep habits were contributing to terrible stress and ill health a number of years ago. And she wrote this really great book. And there are many activities that can improve our sleep quality that we have access to. And that includes mindfulness meditation, cognitive behavioral therapy. All of this can be found online, and we focus on this in our monograph. How bad is sleep deprivation in the COVID-19 era? I have it, and it's pretty bad as a population. Our sleep department here is one of the most overbooked. You have to wait for a long, long time to get a sleep appointment because of the effects of the pandemic on our health. You don't have to be a statistician to understand this graph. These are people starting out here. This is overall survivability. This is people that sleep good in green. These are people that sleep kind of bad. And these are people that sleep really bad, who have insomnia. And as you can see, the rate of cumulative survival is highly correlated. That's just as important as managing your cholesterol or other features. Sleep deprivation, this is a very fancy way of saying no inflammation and inflammation. And this is what happens when you put a person in the sleep lab and you stop them from being able to fall asleep. This has been shown in patients with inflammatory arthritis, rheumatoid, hasn't been studied in SPA, is that when you do this to the patients in the laboratory, within 3 or 4 days, their CRPs rise and their arthritis pain increases. And if you have spondyloarthritis, you know that the morning hours, getting up, is the toughest time of day. So getting that restful sleep is very, very, very important. Final stanza before we get back to talk about how to get this done is that stress, and that is a societal stress and then an individual stress. And over the COVID pandemic, both anxiety and depression and sleeplessness have only risen in our population. This impacts our immune system. But there's good news. And this starts with my mantra, and I tell every one of my patients this, is that your brain and your immune system are one organ. They're not two. The immune system is the seventh sense of the brain. And when our brain is working good, our immune system is augmented and strengthened. And when our brain is stressed and depressed and lonely, or PTSD or any of those issues, it drags our immune system down and creates inflammation. So all of this is connected. But the good news is that there is a growing science of brain and immune health. And there are things that we can do that not only make us feel better or well, but actually can tame down that flame of inflammation induced by these psychosocial changes. And I classify them into top-down, working with our brain, mindfulness meditation. I'll say a few words about that. Or working from the bottom up with exercises, whether it be yoga, Tai Chi, or Qigong. Finally, there are other things in this world that can soothe our brain and our immune system. And this is one of my favorite, and that is nature walking. And in Japan, that is called Shinrin-yoku, or forest bathing. And there's a growing a body of data on immune health from this. So when we actually study this experimentally, and I'm not trying to overpower you with immunologic data, but people who meditate have decreased inflammation, strengthened T-cell responses, and slowered biologic aging of the immune system. It is salutogenic, favors health for the immune system. But we're trying to find out right now, how much do you need and how do you do it? This is one of the most famous studies of early immune studies. This was done by the late Dr. Herbert Benson of the Benson Institute at Harvard. And this is genes. These are healthy people. These are people that are changing, that don't meditate. And these are master meditators, people that have done this for their whole lives. And you take a person who doesn't meditate and you just teach them after 8 weeks. And now this looks more like this. And that shows, those genes you're given at birth. This is how you're playing those cards. So even 8 weeks of training of mindfulness meditation, which can be done online. And I do an app called Stress Free Now, which is free, can get you on the road. But there are other things that I'm so much more interested in right now. And I'm trying to design programs for all types of arthritis and immunologic diseases based upon these mind-body exercises. Much work has been done in Tai Chi, and a growing body of work is done in Qigong. These are both mind-body techniques. They include mindfulness, breathing, and movement. And movement is the one thing that I think offers the most for us for our vitality. It gets us toward a higher degree of fitness. And work done at the Osher Institute at Harvard shows that moving the body strengthens the brain. And I do these exercises daily. You can do them seating. Qigong can be done with gentle movements in a seated position, rising and falling, combining with your breath, or you can get up and do it in a very physically demanding way. When I work with my patients on wellness, I actually do it with them in the office, and they know that I believe in this. There has been a lot of work on Tai Chi, which is a kind of a cousin of Qigong, and it can be done in very forgiving forms for people with arthritis as well. All of these can, by the way. Don't say, I can't do this because I have spondyloarthritis. It can all be modified. This is a great book. It's older. Peter Wayne is the head of the Osher Institute at Harvard and has demonstrated through experimentation that these type of programs can reduce fatigue, increase mental alertness, improve our bone density, reduce pain, reduce our risk for chronic diseases, all of the above. This is the New England Journal of Medicine, the leading journal in the world, showing that a randomized controlled trial of Tai Chi can reduce the signs and symptoms of fibromyalgia. This also has been shown to be effective in other conditions and some growing evidence in spondyloarthritis. I just showed this to you because this is evidence. This isn't opinion. Very, very important. A form of Qigong has recently been studied in ankylosing spondylitis and appeared to improve AS symptoms. This is called Guadan Jin. This is one of my favorites, usually done standing. And you combine our breath. It's the beginning of the 8 brocades. All of this is something that is an adjunct to the great care that you should be getting for your spa, can be improving your immunologic wellness. These are just some pictures of some of these movements in the 8 brocades, and every one of these can be done in a seated position. I love this because it is the beginning of that journey of 1,000 miles with one step. So finally, you can keep an eye out for this. This is called Immune Strength. This is a way that we are going to be teaching our patients how to do this with an online program, with a coach that can come to you over your phone or your computer and keep you on track, eating healthy, exercising, trying to improve your sleep and decrease your strength. We're now testing this in 100 patients with psoriatic arthritis, some of which will have spondyloarthritis. We hope to have some results next year and be able to distribute this more widely if it's working the way that we hope to. Finally, this monograph we have on maintaining a healthy immune system with all these tips will be made available for you to download as a PDF. Give it to all your friends. It's free. We've given it to thousands of rheumatologists across the country. And now I look forward to engaging with all of you in a good discussion about what wellness can mean to you and how you can get it. So thank you very much.
Great, thanks. We're going to get together with all the panelists now. So I have Brandon and Brian, our 2 patient panelists, and I have Dr. Calabrese and myself, who are rheumatologists, and we want to take on your questions. So we got a lot, so I'm going to dive right in. I'm going to take the first one just to allow the panelists some time to think, but I think this first question is great. It's what if I have multiple types of different arthritis as well as fibromyalgia? So I think this is really important to note. So just because you're diagnosed with ankylosing spondylitis or psoriatic arthritis doesn't necessarily mean that that is all that you have, right? And I think that's sometimes what makes it a little confusing when you're getting treated, because your physician that you see on that day might be really focused on your psoriatic arthritis and treating that, and maybe not really understanding that osteoarthritis can sometimes play a role, right? You can lose joint cartilage and you could have overuse syndromes that could cause osteoarthritis in addition to your psoriatic arthritis, for example. And you can also have fibromyalgia, which is more of a pain, chronic pain, widespread pain condition. And the reason that this is important to note is that the treatments for these arthritis or fibromyalgia are different. So the more that we're able to detail out the type of joint pain you're having and how much might be related to the inflammatory component or the AS or psoriatic part versus the non-inflammatory components, such as maybe a previous injury, osteoarthritis, fibromyalgia, is important, because the more we understand the different types of arthritis you might have, then we can, maybe treat you with more than one type of medication or recommend more than one type of path to get you back functioning the way that you want to. So I think really important question. So I'm glad that Andrea asked that question. So the next one, and I have so many, I'm going to start with Brandon, because this was specifically for you. And I think a lot of people probably have this on their mind. And that's about, how do you know when you're pushing yourself physically? How do you know when you should pull back a little? What kind of techniques do you have? What do you listen to in your body? How can you tell somebody, we're always telling everyone, let's exercise. But then, there's a point where, you have to balance that with, injury or overuse.
That's a good question. And for the people listening and maybe following along and seeing what I'm doing, I want everyone to know that I started very, very small, years ago after I was diagnosed. I don't say that I had to learn how to walk again. I just had to learn how to move through this pain. And so there was a time when walking on a treadmill for 10 minutes was the most I could manage. And I just decided that I was going to make it kind of my life's work to stay one step ahead of this disease. And so I just, I went out, and if I was really hurting, I would see kind of, okay, I can walk 3 miles if I'm in this much pain. I can ride my bike 12 miles if I'm in this much pain. And so I had these kind of little benchmarks that I would set for myself. And if I was in more pain than I was used to, I wouldn't do as much. And then probably a couple of years ago, I mean, I spent years kind of building up to where I could like walk a half marathon or ride my bike 30 miles. And then I kind of had this revelation that, no matter what I do, I'm going to hurt to some extent, right? Probably for the duration of my life. And so I just started walking and running, and I would walk a quarter mile and I would run a quarter mile for 2 miles. And I did that for months. And then I would run just 4 miles. And everything has just been gone up. I don't just jump into this. And I also take at least like one very easy week a month where I may not run at all. I'll just swim. There's zero impact. I'll just cycle. There's zero impact. And I stretch like religiously every night for at least an hour. I take a bath. There's a lot of things I do like behind the scenes to kind of take care of my body so I'm ready the next day. But I also, like, if I can't walk, I don't try and like push myself to go out there. So I will rest, but I also live with a mentality of, if I can move, I will be out there. So, and that's just a personal choice. I don't want to urge people to go hurt themselves. I just, that's how I deal with this disease on a personal level. So.
Right. That's great. Thank you. So Brian and Dr. Calabrese, there seems to be some specific questions about what medications you both are on. So I'd like to redirect that only because I think it's more helpful. Maybe Brian, could you talk a little bit about, maybe when you started a medication and what it was like, and if you had any side effects and how you dealt with that?
Sure. Yeah. So I mentioned that, I had psoriasis first, plaque psoriasis. And I had that in my 20s, and it was severe. It was over most of my body. Wasn't attractive. It was painful. It itched. It was a bad situation. I refused to take any either oral or systemic injection type medication for a long time, because I watched my dad go through some of that a long time ago when medications weren't as advanced as they are now. And he did have a lot of significant side effects that I didn't want any part of. So I resisted and I resisted until the psoriatic arthritis showed itself, and my quality of life changed. So it was a hard decision for me to decide to go on medication, and I went on biologics. But I did it. I have had, to my knowledge, 0 side effects. I was fortunate to be on the same biologic for over 10 years, which is somewhat unusual for a lot of patients. You typically have to change before that. I have recently just now changed just because of some of the waning effects that I was starting to see, not with my psoriatic arthritis, but with the psoriasis. And so I'm on my second biologic now, again, with no side effects. So other than just the hassles of the warnings of the drugs, potentially lowering your immune system, having to take a TB test every year, having to go get blood work every 3 to 6 months, depending on how long you've been on the medication. Just a lot of nuisances like that. But I feel fine. I feel healthy. I don't feel like I've become sick any more often than before I was on biologics. I don't get sick very often at all, fortunately. So as far as any side effects of being on the medications, I've seen absolutely none to my knowledge. And again, it didn't make everything go away. I still hurt every day. I'm in pain, but it's manageable. And, as we've talked about, and Dr. Calabrese went through a great presentation of a lot of the things that a lot of us do is go through the lifestyle changes to make up for some of those deficits that maybe the medicine doesn't take care of. And as I mentioned, my hope is to someday be able to manage my disease with just natural remedies and not have to be on medicine anymore.
Mm-hmm. Great. Thank you. So Dr. Calabrese, there's been some great questions around the risk to your children. So if you have non-radiographic spondyloarthritis, and how do you sort of talk to patients that are diagnosed and they worry about family members? And, we all know that having the HLA-B27 gene, it's pretty challenging research out there because the epidemiology is, sort of very varied between subgroups. What are some of your thoughts around?
As I say, the genes are what you're dealt with at birth, and you may carry susceptibility genes that are very strong, like B27, or you may carry susceptibility genes which are not strong, because there are a lot of people that have this that are B27 negative. Regardless of that, we have lessons not so much from the SPA literature, which is rather small, but from the RA literature. If you have one person in the family, if you have identical twins that carry the same identical genes across the board, that doesn't mean that the other twin is always going to get the same disease. In fact, discordance is very high. So we make the point that, starting early with healthy life, I feel bad for people that have gained a lot of weight in childhood. It becomes extraordinarily difficult to manage in adulthood. Not overlooking stress and social isolation, and certainly creating an activity habit, that at least in the sweet spot is, moderate physical activity. Doing extra and being an elite athlete is great, but you don't have to do that to achieve immunologic wellness. And paying attention to all these things. So, when I see people who come because they have a first-degree family member, we put them on this immune wellness strategy, and we get them to work with our integrative doctors who have programs that will do this. That's what you do. Great.
So before I go back to Brandon and Brian, Len, I just wanted to ask you really quickly, because there's a great question about sleep, and sometimes it's really difficult to get a good night's sleep with these chronic pain. Should I take a sleeping med? Should I? How do you go about counseling somebody who's having poor sleep?
I don't have a soundbite answer for that, because sleep is complicated. Is it difficulty falling asleep? Is it early morning awakening? Is it because you're awakening in pain? which is so common in spondyloarthritis. To me, that's a sign that the disease is uncontrolled and you really need to up the ante on therapy. You know, people that have spinal pain, axial pain that is suppressed often immediately transform their sleep to begin with. So that's a warning sign for me. You know, and I'm going to add this just as one point. And I hear Brian and Brandon and myself, you know, you wish to take no medicines, but, you know, you should be very cautious not to wind up being your own worst enemy for this. I wish that when I was in my 20s and this was really bad, that there were biologics. I think it would have transformed my life. I was fortunate that mine pretty much burned out over the decades. But, you know, these medicines can be given with an excellent benefit to risk profile taken by a knowledgeable patient and a concerned practitioner. Once pain is controlled, and that helps reduce fatigue by itself, often adopting these wellness behaviors becomes even easier. So, you know, yeah, that's aspiration, but, you know, don't undertreat yourself.
Yeah, great message. There's been a lot about questions around having chronic pain, chronic disease causing stress, and how do you find ways to reduce stress from pain? So Brandon and Brian, could you just give us your sound bite, maybe some teaser, something people in the audience can go home with? How do you reduce stress from pain? Brandon?
So I have found that taking a bath is very helpful. And I mean, I'll be real honest, I take a bath every single night. It's become kind of like just a thing in our house. You know, I take a bath, my wife takes a bath, sometimes our son takes a bath. It's just it's like getting ready to sleep type thing. And over the years, like if we don't have that part of our routine, then like it's just something feels off. So I found that like a very hot bath is very helpful, especially if like my activity level for that day has been really high. And I also, I am a huge advocate of like a daily meditation, at least 30 minutes, like for me, because I don't sleep very much right now, not like related to my disease, but kind of the journey I'm on. That's another thing. But if I don't get 30 to 60 minutes of a daily meditation, then
wow,
I have a rough day. And I always do a guided meditation off of YouTube. I did one today for 30 minutes, and that has really changed,
Cool.
My life. I think I'm a huge believer in it. And if you can find the time, definitely try that and just shoot for like 12 minutes, 15 minutes, and then start to go longer and do it guided. That's what I would recommend. So those are my two like big
go-to. Excellent. Ryan?
I think for me, it's mostly activity. So, playing hockey, running, doing things that are active around the house, even getting up and going for a walk, whatever that might be. I think that's how I relieve stress most of the time. And I saw in the chat there was questions on, well, how do you relieve stress if you have chronic pain? And sometimes that's a challenge because you're hurting, but I choose to still go play my hockey game in pain. I choose to still go run in pain. That's how I get through it. And it 9 times out of 10 always makes me feel better. I'll give you a perfect example. Like I'm training for a race right now, not an ultra marathon like Brandon. I'm doing a 5K. I ran today midday just to get out and stop work for a while. Ran my first mile in a great time. Second mile, third mile, I started to flare in my toes, and that happens sometimes. And it just went downhill from there. But I finished my walked around the neighborhood a little bit, felt good, came back, went away, and when I went on about my day. So I do some other things too. I fiddle around on my guitar, I draw, I mess around in the garage, just anything that gets your mind off of the things that stress you out. My kids are a big part of that. I love to spend time with my kids and my family. That releases my stress too. So those are the things I do. And Dr. Calabrese, spent a lot of time talking about diet. And I think for me, I mentioned I've changed my diet a lot, but some advice I would give too is don't let diet stress you out. Because for me, for a long time, I was trying to be so strict on a diet, and that gave me more stress than anything else. So I like Dr. Calabrese's VB6 method, and I call myself gluten conscious because I didn't totally cut out gluten. I still like drinking a beer once in a while. So I just make good decisions most of the time, and that's a lot less stressful for me than trying to stick to just a super strict diet.
Can I add just something here at the end that, these guys are awesome, and I hope that people who are watching this appreciate how much effort they have put into their own personal wellness. And I don't want anybody to become frightened of that these guys are high-level athletes and doing super things. All wellness and all illness, as I said in my talk, is very personal. And, what's stressful to you may not be stressful to Brandon or Brian or myself. And what's stressful to me may not be stressful to you. And so, the journey of 1,000 miles, takes a lot of twists and turns. So, you pick the low-hanging fruit. If the worst thing you're doing is being sedentary, you start doing that instant recess. If you have a really, crummy diet, you just start cleaning up, one meal a day, or have a meatless Monday or something. It doesn't all come at once. And stress, Brandon, I can't tell you how much I love your mindfulness meditation, but either some type of top-down mindfulness technique or just get involved in some type of mind-body technique, which serves both purposes, and do it a little bit at a time.
Yes, I love these real-world examples as one of the last questions that I saw. I think this is really what resonates with us. I know we're getting close to the hour. I'm going to squeeze in one quick kind of sciencey question to Dr. Calabrese because this comes up a lot. There's a question on does periodic antibiotics have any role to decreasing symptoms?
But it has a lot of role of trashing your microbiome.
So I don't.
Antibiotics are the greatest gift of the 20th century, but need to be used very judiciously.
Thank you. Yeah, I just thought that was an interesting question. Just wanted
yes,
to
I know where it's coming from too.
Yes, great. So I know we're getting close to the hour. I would like to see if the panelists have any final words before I have some closing slides. But I wanted to thank for all the great questions that we're having.
Very privileged to be here. Thank you.
Yeah, thank you as well. And as Dr. Calabrese said, this didn't happen with Brandon and I overnight. It's been a process for us to figure out what works for us for a long time. And so everybody's different. Do what works for you.
Excellent. Brandon?
Yeah, I got to agree with that. I mean, just a lot of trial and error, and don't sell yourself short. We are capable of living a very big life. It's going to look a little different than you think, and it's going to take a little bit more effort. But I think our ability to suffer is unmatched, and we can move through anything that we put our minds to. We just have to put forth the effort. And I also want to say, because I think I've been getting like messages on Instagram and stuff. If people want to follow my journey on Instagram, you can. It's do as is. And I'm also raising money that goes directly to spondylitis for this run I'm doing. And I just want to thank you guys for having me on. And I hope that the listeners can just take away, one thing, just change one thing at a time. Like pick the low hanging fruit, if it's, I'm going to walk today, or I'm going to stop eating cheese. I'm going to get rid of a little dairy, just change one thing at a time. Make it easy on yourself. Do that for a while, change another thing, but don't ever sell yourself short.
And if you're interested in the immunology of wellness, follow me on Twitter, Calabrese, easy to find.
Calabrese, excellent. We have all these social media minds. This is great. So thank you all for your attention and especially for the panelists for their candor. And hopefully this inspires you to not only have a conversation with your family around wellness and your disease, but also with your physician and things that they may direct you to or help you do as well. We want to make this mainstream. We want to make this question about what are you doing for your wellness today as mainstream as how you're doing on your medications. So thank you, everyone. Next slide, please. Just to remind everyone that please let us know how we did. We love the feedback. Your feedback is really important to us. Thank you for spending the evening with us, and please visit us on here or scan the QR code to let us know how we did or what else you want to know. And next slide, please. Just as a reminder, this is check out our podcast. Has some more tidbits that I did with Brandon and Brian. We had a lot of fun doing this. It goes into a little deeper dive about lifestyle habits. Next slide. And last but not least, we are CAPES webinar. We are the number 4 or the final episode. But if you want to go back and listen to the other episodes, please visit on capes.porfameta.com/login, and you can see that there are 3 other series that you could see in addition to the one that you joined with us today. Next slide. So thanks a lot for your attention, and a big thank you for Brandon and Brian for really staying on this evening and really being so informative and inspiring.